Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicos. Today I am going to discuss about the rare disorders of respiration. The less common disorders of respiratory system includes Haemothorax Chylothorax and Hydatid disease. Haemothorax. Haemothorax is defined as the collection of blood in the pleural space. It is usually secondary to trauma but may also occur in other conditions as tumors, tuberculosis, etc. Physical findings. Physical findings are those of pleural effusion and blood loss. Treatment. Treatment consists of removal of blood and attention to the basic underlying condition. Chylothorax. Chylothorax is defined as the pooling of chyle or lymph in the pleural space. The usual cause is the trauma to the thoracic duct, either accidental or surgical. Other causes include the congenital anomalies of lymphatic ducts, obstruction to the thoracic ducts by enlarged lymph nodes or tumors. In rare cases, may be due to tuberculosis or filariasis. Signs and symptoms are those of pleural effusion. Diagnosis. Diagnosis is established by thoracocentesis where a milky fluid is obtained. The differentiation from the accumulation of fatty material is made by feeding the patient with the dye fat soluble D and C with the green number 6, which will color the chylous fluid. Repeated aspirations are required to relieve respiratory distress. Children become rapidly depleted of protein, fat and fat-soluble vitamins. Gross pleural fibrosis occurs with healing resulting in scoliosis, contractions of the hemithorax, ligation of the thoracic duct. Ligation of thoracic duct is preferred when the conservative measures fail. Hydatid disease. Hydatid cyst of the lung is uncommon in children. Well-matured cystic development in hydatid disease takes a number of years. A lung cyst which may be single or multiple is usually secondary to the existing liver cyst and occurs mostly as a result of hematogenous spread. Mostly the cyst in the lung is silent and asymptomatic, and the symptoms are produced only in a complication like the rupture of the cyst into the bronchus, ruptures into the other contiguous structures like pleural cavity, pericardial sac, or rupture into blood vessel onto a fulminant anaphylactic shock. Rarely a secondary infection may supervene and complicate the picture. Signs and symptoms. Clinical signs resemble that of the cystic lesion in the lung, like impaired percussion note and bronchial breathing. The increased vocal resonance. The rupture into the bronchus may be evident by the history of a sudden coughing out of grape-like material. Diagnosis. Diagnosed based on the finding of the radiology. Depends upon whether the cyst is intact or ruptured and the degree of calcification of the wall. Cysts may be single or multiple and may be located anywhere in the lung, and if intact gives rise to a homogeneous circular well-defined opacity. When the cyst ruptures, it produces a distinct radiological features described as water lily sign, where in the ruptured superior portion of the cyst wall will float beneath the fluid. When there is a minimum breakthrough in the cyst wall, a characteristic crescentric air shadow in the upper part of the cyst, namely pericystic pneumo, is present. Total leukocyte count, differential leukocyte count showing eosinophilia. CASONI'S test. Immunological test like CASONI'S test is positive only in 50% of cases. Complement fixation test and H.A.I.TEST may be done. Treatment. Treatment is essentially surgical with attentive anesthesia help and adequate positive pressure ventilation. Recent clinical trials claiming the broad spectrum anti-emetic like thiabendazole in large doses given for 6 months. It is under experimental consideration. That's all about the rare diseases of respiratory tract, and in the next video I will discuss about some other disease.